I've dealt with mental health and drug addictions for 30 plus years. My grandson is 29. He suffers from severe mental health and drug addictions, and he's been hospitalized 14 times in the last year and a half. He's lost, and he doesn't know where to go, and he doesn't know what else to do.
We are still struggling. We are really struggling, and our journey goes on.
I'm doing this because I want to save my grandson's life.
I was the counselor. I was not only the caregiver, but also I was a counselor. I was a psychiatrist, a psychologist.
My son has done very well, but he did relapse about 3 years ago for many reasons that are very legitimate. So I was back in the hospital setting, and I still had that same feeling of not being listened to. I think there just needs to be a whole cultural shift towards understanding where the caregiver is at and the importance of making that person feel like part of the team. And understanding it's a partnership with the service providers, and we are key, and we do need support, yes, but sometimes we just need respect and to be heard. Some of our stress comes from the fact that we don't see our loved one getting better. We know that they're not getting what they need. And it always goes back to, and this is why we talk so much about that, is if they could be better, we can be better.
What would have the greatest impact on alleviating the burden for caregivers is better access, quicker, more timely access to mental health care services.
When a person goes into a hospital, their main focus is to take care of their loved one. They forget about the family, they forget about the journey that they've been on and all the information that they hold.
And I know that privacy concerns and confidentiality and risk management, and there's a whole list of things, scary things for service providers to consider. But let's look at what caregiving is all about. Go back to beyond worrying about rules and in legislation, and we move from there to we're a team, we need to work together, and we all have the best interests at heart for both the client or the patient or the person and those people who love them.
I think it's also important to educate ourselves. Try and go out, like going to the hospitals. I mean, they don't always tell you what you need to do, they don't. But you have to kind of put yourself out there, try and find what is available to you.
I went to the hospital so often, talked to the doctor often enough, and then absolutely no information given to me.
Could be counseling, peer support, housing information, fair wage, job training. It was a whole range of things.
He gets hospitalized for sometimes a week, sometimes 3 weeks. And during that time, all they do is give medication. To the best of my knowledge, there was absolutely no guidance, no nothing, just medication, and then wait until he stabilizes. As soon as he stabilizes, that's good enough for them, just out the door. Nobody told me what was available. I was completely on my own.
We can't be forgotten, and that is what is happening.
There's a time where we need to be able to sit back and reflect and have some respite. Or have somebody else maybe step in and help us.